right now, what has been happening within global health, and it will take a while to be changed, is that global policies and priorities are defined at the global level in big rooms in Geneva, New York, and the likes. Then no matter how much domestication and adaptation we say we are doing it's in our countries, it's never like a bottom-up process. And the bottom-up process within global health is perceived as inviting a few people from selected countries, usually always the same, to participate in those meetings and define what the global needs and priorities are. What we need to do, what the new public health order is to say, between the global level and the national level, with so much resources that just need to be better harnessed, that need to be better targeted into our own interest. There are institutions within the continent that played major roles. If you take the Institute Pasteur of Dakar, for example, in providing not only training capacity building, diagnostics, cross-reference labs, etc., and supporting countries in the and labs in the sub-region. Many countries, I take my example, the example of my country, as I was the High Commissioner for COVID-19. You would never think that we will be doing genome sequencing in Guinea-Bissau. Even when I was Minister for Health, I didn't think in just the following year, we'll be doing that. But when you don't have any other alternative, then you push for homegrown solutions. And this is what happened to during the pandemic. And I think we are on an irreversible path. We need to build capacity. We need to use the expertise. There is so much expertise within the continent that is not brought to contribute to improve healthcare, and we need to address that. There is also the important role of domestic investment in our health infrastructure. So before we look for proposals from X, Y, and Z, we really need to get our own resources. And Africa has resources, much more resources to invest in health than it's being contributed so far. New public health order also means that we need to listen to our communities. They know what they need. They know they have solutions to their own problems. What we need is just to help them translate that into the right policy solutions and give them the resources in terms of therapeutics, diagnostics and vaccines that they need. And we will be much better if we look inwards while also at the same time working with our partners, which have been with us all along, to make sure that their investment actually adds to what we are doing, and it's not a duplication or a replacement to what our governments could have been doing, and that they target the right needs of our population. I think on the same vein, there is now the African Medicines Agency that is being established, which was a long overdue technical organization to support pharmaceuticals, local production, regulation work that is so much needed in order for us to have quality health, quality medicines, and better health in Africa. What I think is the strength, but so far is perceived as probably more of a challenge, is the wide diversity of the continent. From Cape to Cairo, there is a wide variety of culture, social, ethnic groups that we have not yet found the best way of uniting in diversity and then pulling on our strengths to move forward. We don't need manufacturing, vaccine manufacturing units in every country. We need to see where best our capacities is. We need to have unity within our diversity. That's our way forward to become the continent, I will not say of the future, because Africa is already, the future is today.